Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we bring this podcast to you every Wednesday as a veterinarian, as a technician, as a dentistry team to help you be even better at veterinary dentistry in your practice. We're sponsored and partnered today with the Veterinary Dental Practitioner Program. If you're interested in being among the best anywhere in general practice as a team in veterinary dentistry, I invite you to request an invitation. Just go to ivdi.org/INV, like invitation, first three letters INV. So IVDI, International Veterinary Dentistry Institute, ivdi.org/INV, and we'll get you the information that you need.
In the event that the owner doesn't want to proceed with a procedure, what would your pain management recommendation be? Dental diet, antibiotics, pain control. So pain control and other adjunct care. Haley, sorry about that. The way to approach this would be from a anti-inflammatory standpoint. So anything that you can do that's not systemic would be grand, and TDC is an esterified fatty acid. It's an oil in a gel, or oil in a capsule, soft cap that you can break open and put on the food, or have the owners put on the gums, or just kind of squeeze in the corner of each side of the mouth. Many cats just take it right off the little gel, soft gel, and love it because it's an oil and there's no bad taste to it at all. So that in itself decreases the inflammatory cascade. There's been research done on that for humans and periodontal disease, and there's been research that's done on that in dogs as well, and it does decrease inflammation associated with periodontal disease. So that would be the go-to thing of choice, would be TDC. Antibiotics, not going to be helpful. It may decrease the odor, it may decrease the tissue, superficial tissue inflammation, but it's not something that we want to do long-term. Pain control, if this is a chronic problem, certainly gabapentin can enter in there. NSAIDs certainly can be used short-term to kind of get a handle on this. But essentially, and none of this is going to do anything for the progression long-term, except for maybe TDC may slow it down a little bit, but eventually these cats, and some of them, I think we probably mentioned this in the course segment itself, some of these will be full mouth extractions eventually. So keep that in mind. Next topic, and that's that vestibular bone expansion we talked about. And this is what Dave is talking about here, where we've got that bone expansion that we have in this case around the mandibular canines, where you can see that radiographically, where we have a expansion of the bone around the marginal bone. And his question is, if those canines are saved, which we showed you how we do that from mainly a specialty perspective, just to let you know that it can be done. Most of these are going to be extractions in your hands, but if that is done, we need to maintain the periodontal status by cleaning, TDC, healthy mouth, anything that we mentioned in these previously, to decrease the interval between cleanings in the hospital. But they're still going to have to be managed in order to make sure that expansion is not something that's progressive. But it certainly depends on the patient's age. If we see this at 6-8 years of age, we're not going to have to be that specific and that aggressive with our care because it took that long to get to that point. But if this is a young patient that's 3 or 4 years of age, then we probably got some component of juvenile onset perio. We may get progression. So we just have to keep that in mind. So Caitlin Would you recommend extraction for mandibular canine teeth? In the first case, if the owners are not able to bring the patient back for follow-up every 3 to 4 months, absolutely. So that situation with these mandibular canine teeth, that's not going to be something that we can't do that aggressive approach that we showed in the case itself and expect this to be something that we just leave alone. So sure, and that's going to be the case most of the time. When you see vestibular bone expansion, either in the mandible or maxilla, there's usually some tissue involvement there, and there may be severe tissue involvement aside from the bone. Usually the bone is the primary thing that's affected. And then you have the granulation tissue in the bone. You have the osteitis, osteomyelitis on the surface of the bone as it expands. So, yeah, that's an indication for extraction for sure. Katie asked, if we don't have a bonding agent, would you suggest extraction? No, I wouldn't go that far to say that. If you know how to do this procedure and you don't have a bonding agent, cleaning that surface off, that's going to be exposed a little bit, but that's not an area that I would be really concerned with from a standpoint of discomfort. Bonding is what we always do because we know that we've exposed some dentin underneath that cementum that's been destroyed when we clean those off, but it's not going to be that significant in that small an area to be super concerned. But again, most practices we're not going to be doing that procedure. It is an option for owners that don't want to extract, so you can let them know that referral is the option to save those, and that in itself is a client education measure to enhance the compliance of the client to actually do the extractions early before these get bad. If the client's got to go for a referral and that referral is going to take them time, they've got to wait for it, they've got to go, sometimes they've got to go twice to the specialist, they're going to be more likely to say, okay, well, let's just extract that. And if you don't offer that and say, hey, we need to extract these, there's no way to save them. If you say, yeah, we can save them, if that's the option, some cases it wouldn't be, but if like in this case, if we can save them, then yeah. If you don't want to go, then extraction's the way to go. It may be a little bit better from a compliance standpoint. So good question, and I just kind of thought about that from that standpoint. I think that's a great point, Caitlin, that you bring that up. So Cindy, with bone expansion and loss of the canine tooth that you described with the malodorous debris and all the changes, do you flush the alveoli with chlorhexidine prior to surgical manipulation? You can. If you want to use 0.12% chlorhexidine, some people do that routinely when they do extractions. We don't use it when we're doing any kind of tissue management with saving teeth, because chlorhexidine, even at 0.12%, will kill fibroblasts. So we don't want to do anything like that if we're trying to save teeth, or we're doing regenerative procedures where we're trying to grow bone with bone grafts, because the fibroblasts make up part of the healing tissues that come in, and so we don't want to alter that. So we don't use it because we do a lot of those. We've never used chlorhexidine. We don't feel that we need to do it. Excuse me. Chlorhexidine also will cause some discoloration of the crown, and that's not why we use it. We don't care about the cosmetic effects, but it's just I think it's overkill. You've got an immune system there that can handle whatever you throw at it in the oral cavity with a good blood supply. So I just think it's a little bit overkill. That's my opinion, and that may be wrong. Okay, let's move on. You saw that image. So, you send home antibiotics due to osteomyelitis due to the vestibular bone expansion. Haley, if we do, it's because there's osteomyelitis that we can't remove. When we're dealing with that expansion, we're going to be removing the bulk of that bone we're going to be doing in about alveoloplasty on the surface of that bone, getting down on the palatal side or the lingual side, so that we've got nice bleeding bone, that surface inflammation's gone, any granulation tissue that's in there, which it will be from the expansion itself, is removed. So almost never in these cases with vestibular bone expansion. And then Wendy asked, what is the longest time frame that you would recommend allowing between procedures and radiographs if cost is a concern for the owner? I assume you're talking about the cases with bone expansion. The bone expansion removal eliminates having to do rechecks. The teeth that are left, depending on where they are, cats usually are pretty good from the standpoint of perio every year or so, even though they're small, like small dogs. No way a year in most cases is going to be enough. Even in the best of breeds, usually you're going to have dogs 15 pounds or less, or in this case, comparing it to cats, 10 pounds or less, you're going to have significant bone or significant progression, but in cats, you just don't. So 12 to 18 months generally, sometimes 2 years, is perfectly fine in many cats that aren't affected significantly. And this is usually something that happens in cats that are a little bit older.
I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at ivdi.org/INV.